Hello, am I audible?
Yes, sir.
Okay.
Yes, sir.
Yes, sir.
Okay, is the screen visible to everybody?
Yes.
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 Okay.
Yes, sir.
Okay. So as we have already said, that team A is IPGMER, team B is Medical College, team C is RG Medical College, and team D is School of Tropical Medicine. So please identify yourselves in accordingly. Team A, IPGMER.
I'm Shubhashmita Vaishya and
Pramit Nandi from
from
IPGM.
IPGM.
Okay, you both are second year. Please mention that.
Third
also.
year.
Third year.
Third year. Okay. So next, team B, Medical College, Kolkata.
I am Dr. Supratim Karmakar, third year PGT, Medical College, Kolkata.
I am Dr. Saurabh Das from same year.
Okay. Then comes team 3C, RG Medical College.
Here, Dr. Shishik Das and Dr. Madhav Datta from RGO Medical College.
From third year.
Third year.
Okay. And Tropical School of Tropical Medicine, please, you have to keep the video on for the entire duration of the quiz. School of Tropical Medicine, please switch on your video and identify yourselves.
Sir, I'm Kaushike Ajra. I'm a second year PGT of School of Tropical Medicine.
Yes.
I'm Adi Ampi, third year from School of Tropical Medicine.
So please switch on your video.
Sir, it's switched on.
But we can't see you.
They have logged in from
Can
a
you see
different device. It's visible.
Yeah, now it's fine. Okay. So I think the teams have been formed. I am Dr. Indrashish Poddar, and with me we have Shreya. So we'll be conducting the quiz. So just let's get a. So this is us, and as we have, congratulations to all of you for qualifying for the finals. And there are a set of rules which we would like to first. So the quiz observer is, of course, Dr. Professor Arijit Kundu sir, who is the senior one of the most senior faculty of IIDVL West Bengal, and he is the emeritus professor at KPC Medical College. I am quiz master, and of course we both are quiz masters, so it's just written there, so that's nothing. So I am at Sagar Datta Medical College, and she is at Asansol District Hospital. So these are the set of rules. Now we are going into the quiz proper. So we will have 6 rounds, and from round 1 to round 3, that is the first 3 rounds, will be conducted in a clockwise manner. So we will have it as team A, B, C, D, and the rounds 3 to 6, the last 3 rounds will be conducted in an anti-clockwise manner. So that is D, C, B, A. I just like to again remind you the teams are, the team A is IPGMER, team B is Medical College Kolkata, team C is RG Medical College, and team D is School of Tropical Medicine in alphabetical order. Questions will not be passed to the next team because there is an online platform, so there is no option of passing the question. So the question will be directed towards a particular team, and either you answer it correctly or you don't answer it, or you answer it wrongly. So it ends there. And in case of any discrepancy or any kind of doubt, the decision of by the quiz observer will be deemed as final. So there can no questions be asked on that decision. So his decision will be final and binding on this quiz. And in case there is a tie, so in that case, the marks obtained in your prelims will be taken into consideration. And even if prelims marks are tied, then there are, as you know, that in the prelims there were some star marked questions. So we will go to those questions to find the winner. So now let's move forward. This will be our 6 rounds. So a round on general dermatology, pediatric dermatology, dermatopathology, then STI Hansen's disease, dermatotherapeutics, and the final round on dermatosurgery and cosmetic dermatology. So as we have already announced, the first 3 rounds, general dermatology, pediatric dermatology, and dermatopathology, they will be in clockwise fashion, A, B, C, D. And the last 3 rounds, they will be in the anti-clockwise fashion. So D, C, B, A. The first 3 rounds will be conducted by me, while the last 3 will be conducted by Shreya. So are you all ready? so we can move into the quiz. Everyone is ready?
Yes, sir.
Yes, sir.
Yes, sir.
Yeah.
What will be the duration for each question?
The duration, yes. Let us clarify that the timer will be switched on after we have finished the question, and we'll be saying the time starts now. Okay, Quibix team,
Sir, can we have the timer visible to us? Because it's not visible actually.
you
right?
have the timer visible. It's just, so we'll have 45 seconds.
There also one question, sir. Do we have negative marking here?
No. There is no negative marking. There is no negative marking. The marking pattern is different for some rounds. We'll be announcing at the beginning of that round.
Okay.
Sangamitradi?
Yes, sir.
So
Can
have you
everyone
followed?
see the timer?
Yes, but have you followed that we will be saying after the question has finished? We will
Yes.
say that the time starts now.
Yes, sir. Only after
we-
you saying
yes,
time starts now, I'll start the timer.
Exactly. Okay. So
Okay.
all good with you? So again, tropical medicine has been, where are you guys?
Timer
Okay.
is visible for everyone.
Timer the video.
Okay, so let's get started. So this is for the round A. So the round 1 will be on general dermatology, and you will be given a set of pictures. Okay, so there may be 2 or 3 pictures. So you have to connect those pictures. Those pictures are actually clues. So we'll be connecting those clues or the pictures to name whether that's any condition or any spectrum or whatever it is. So basically you have to connect those pictorial clues and come up with your answer. Now there is another thing, please keep your mics muted for your own benefit, because we don't want the other teams to discuss whatever is going on between you. And if there is any such person who tries to interfere in between, so that will be negative marking on that team. So please make sure that there is no background noise coming on part from you. So this is the question number 1 to team IPGMER, team A. Okay. So clue. So as you can see, there are 2 pictures. You have to combine this clue and come up with the answer. What condition is this? So the time starts now.
Perry-Romberg syndrome. Perry-Romberg.
Very good. So team A gets 10 points. Congratulations. And the scoring, I think we have missed. There will be +10 for each correct answer. There is no negative marking, and the pattern will be different. For this round, there is a direct question round. So there will be +10 for each correct answer and 0 if you can't answer it properly. There is no passing, as we have already mentioned. So this is Perry-Romberg syndrome, progressive hemifacial atrophy. There is a facial nerve atrophy on one side, and there's a fissured tongue. So now we come to the next question. So team B, that is medical college. So there are 2 extra pictures, and there is a picture which is from the leg and a face. You can see the picture. There are different conditions. So you have to identify what syndrome which we are talking about. So your time starts now. Analyze each picture. There are different components of the syndrome.
Is this Papa syndrome?
Sorry?
PAPA syndrome.
Okay, can you elaborate it?
Sir,
What it stands for?
Sir, pyoderma gangrenosum,
Pyogenic arthritis.
acne.
Okay, so the pictures are very clear. Okay, congratulations. So 10 points to medical college. So as you can see, the X-rays are of pyogenic arthritis. So that is definitely a clinical picture. That pass will be like, it will be removed. And this is pyogenic arthritis and this is acne. Okay, so good work. So now we come to the next question for team C. So again, facial teeth is seen. This is a biopsy of an organ. You have to identify the organ and also say what it is. And here you can see a nose of a person which is somehow distorted. So what syndrome is this? Your time starts now. This is for Arjikar Medical College, Team C.
This is granulomatosis with polyangiitis or Wegener's granulomatosis.
Very good. So can you identify what is shown in the pictures?
There is gingival hypertrophy with granulomatous lesions. There is depressed nasal bridge, that is destruction of the nasal bones, and in kidney there is glomerulonephritis and necrosis of the renal structures.
Okay, yes. So just okay, the timer can be stopped. They have got it correctly. So 10 points to Arjikar. Just this is a strawberry gum. There is no granuloma on the gum. Granulomas are only found in the internal organs. So they can be found either in the lung or in the kidney. Okay, no granuloma in the gums. The rest are all correct. So this is Wegener's granulomatosis is the previous name, and as they've said it correctly, is granulomatosis with polyangiitis. That's the new name. So congratulations. Now we come to the last question of this round to Team D, that is School of Tropical Medicine. So here you can see a nose with some skin lesions. These are some typical skin lesions, a nail, a slightly disfigured nail, and the back of a person with some pruritic lesions. So you have to, you have to correlate these pictures and name a condition, name the condition in which you can find all these three conditions together. So your time starts now. This is for School of Tropical Medicine. Relate these pictures and say us the condition in which you can find all these three conditions together. First, identify the pictures, try to find out what they are representing, and then try to find out any condition in which all three may be seen together. You have last 3 seconds left. Okay, so time is up. So there is no passing, but can any of the teams chip in with what they think?
Lofgren's.
Okay, anyone else? Lofgren syndrome, you will always get a picture of the X-ray, okay, because hilar lymphadenopathy is a classical finding in Lofgren syndrome. So you'll always get an X-ray. So I'll just state the answer that this is a case of nose. You can see this vascular kind of lesions. This is a Kaposi sarcoma. So this is not exactly the typical site, but there's a Kaposi sarcoma. And the next nail picture shows white superficial onychomycosis. And the third picture is pretty non-specific. There's a pruritic papular lesions on the back. So can you now name which condition we are referring to?
HIV.
These are the cutaneous manifestations. There are a lot of cutaneous manifestations of HIV. These are three typical ones which I've shown here. So we come to an end of round A, round 1. So right now the scores are IPGMER, Medical College and Arjikar. They have all earned 10 points each, and STM is yet to start their innings. So now we move to the round 2, which is on pediatric dermatology. Now, as I said, there will be some differences. Now, this round, each question has got 2 parts. So if you answer, so each part carries 5 marks. You will be given both the parts together. So basically, you will be asked 2 questions. For each question, there will be 2 subparts, and each subpart carries 5 marks. So you answer both of them correctly, you get 10. Any one, you get 5. So there is no negative marking. So are you ready? This again starts with Team A, IPGMER. Are you ready?
Yes.
IPGMER? Yes. Okay. So here is your question. So a female patient, you can read it, that she was referred from endocrinology, and these are some cafe au lait macules. I think you can appreciate it. The parents give a history of bone pain and recurrent pathological fractures. So you have to identify the condition. Your time starts now. And also the gene responsible.
Osteogenesis imperfecta.
Okay, and the gene.
Yeah. One jetter. G. Call one.
No, cafe or the
Cafe only.
segmental.
McCune-Albright syndrome.
Please give us one answer. What is your final answer?
McCune-Albright syndrome.
McCune-Albright.
McCune-Albright syndrome.
Now quickly the gene responsible for it. Okay, so your
FGF.
time is up. Time, yeah. Okay, the time is up. So we'll see that at last you have given the correct answer. So congratulations. And the gene responsible is GNAS1 gene. So you'll get 5 points. Team IPGMER will get 5 points because they have answered this question correctly. Please be sure and then answer. We don't want this to happen every time. Okay. So now, Team Medical College, are you ready for your question?
Yes, sir.
Okay. So here is again, there are some skin lesions you can see on the neck, on the face, on the leg. And this is a patient which was referred to from the Department of Neurology. And you can see the MRI scan of the brain. We will not go to the discussion. So you have to identify the condition and also say the gene responsible for this. Your time starts now. Correlate the pictures, first identify the condition, and then go for the gene mutation responsible for it. Medical College, your question, direct question. Identify the skin conditions. On the face and neck, leg, everything is same.
So leg, is it?
See, there are different manifestations of the same like dermatological condition. You have last 5 seconds left. Be quick. You can just take a guess. There is no negative mark.
Biggos disease, malignant atrophy pathosis.
That's not exactly. So any of the other teams, there is no marking, but any of the other teams want to take a.
Ataxia telangiectasia.
Who answered first?
Sir, tropical. Ataxia telangiectasia.
Yes, very good. Can you name the gene responsible for this?
ATM gene.
Very good, very good. Very good. So this is these are just hypercortical areas. Okay. So the cerebellum area in the first picture you can see. So cerebellar ataxia and telangiectasias on these pictures. So very good. Yes. So team 2 will get they will not get any point for this round. Okay. So now we move on to team C, Arjikar Medical College. Are you ready? Arjikar?
Yes, sir.
Okay. So this is ataxia telangiectasia, ATM gene. Very good. Now the direct question to team C. So a male child presents to with blastoid areas of atrophy and telangiectasias. Some nodular outpouchings are also there. A very lobster claw is something we get in this condition. Nails are underdeveloped. So can you identify the syndrome? And the mode of inheritance. Your time has already started. Team C, Arjikar. The lesions are there, the distribution is there. So identify the condition and then go for the mode of inheritance.
Gold syndrome, autosomal recessive.
Okay, let's see whether I've done it correctly. That is Gold syndrome. Very good. The mode of inheritance is wrong. It's X-linked dominant. Okay, but very good. Yes, so you'll get 5 points. Very good. So this is Gold syndrome or focal dermal hypoplasia. This is a disorder of the elastic tissue. So now we move on to the last team, Team Tropical Medicine. Are you ready? School of Tropical Medicine?
Yes, sir.
Okay. So now we go to your question. So a female child presented with this kind of generalized erythroderma and adherent blastoid scaling. Which condition will you suspect? And what characteristic extra finding? Whether you'll get any characteristic extra finding. So your time starts now. School of Tropical Medicine, identify the condition which you suspect and whether you will get any extra finding. And if you get any extra finding, what will it be?
Congenital ichthyosiform erythroderma.
Okay. Do you think you'll get any characteristic extra finding there? So that you remain with your answer, you have 5 seconds left. So you can take a guess. There is no negative marking. Okay, so time is up. Any of the other teams want to take?
Conrad
Yes, very good.
X-ray findings.
Stipple epiphysis. The X-ray.
Yeah, what will you get in X-ray?
Stippled pattern is epiphysis.
Stippled.
Stipple.
Okay. Yes, you're absolutely correct. So tropical gets, they don't get any point for this round. But very good. They have answered one question correctly, but unfortunately that was not their question. So we now, okay, we'll get the answer quiz scores at the end of the next round, at the midway of the quiz. So now we move on to the round 3. Now that is on dermatopathology. Now here we have just tried to twist it a bit that, you will be first shown the picture or image. And if you can answer it just by seeing the image, you will get 10 points. And if you ask for a hint, you have to ask for the hint that we want a hint. A single hint will be given to you. And if you can answer it after getting that hint, you'll get 5 points. So is that clear? Clear with everybody?
So will the time start after the hint or before the hint?
No. The hint question you have to ask. So if you are just asking for the hint after 40 seconds have passed, so that is your that is your thing. So you have to just assess it, that whether
So
you want the hint at the
question
very
is put,
beginning.
the timer will start.
Yes. So if you can answer it just directly from the image, you will get 10 points. And if you can't answer it, then you have to ask for the hint. And once after asking, we'll display you the hint. And if you can tell it, we'll get 5 points. Okay. Yes, you have to answer both the appearance and the condition. Okay. So IPGMER, ready? So
Yes,
you'll
sir.
have to
Yes,
ask
sir,
for
yes,
the
sir,
hint.
yes.
Yes. Okay. So your direct question. So we cannot describe this picture. It's a very classical picture. So what condition is this? Your time starts now. If you can understand, you can always ask for the hint, but then you'll get 5 points only.
Really?
No.
See-
Well,
Yeah.
trichoepithelium. Cylindroma.
Cylindroma.
What is your final answer? The
Cylindroma.
time has stopped.
Cylindroma.
Cylindroma. Okay. And what is this picture appearance called?
Jigsaw puzzle.
Jigsaw puzzle.
Sorry, it's unfortunately you could have asked for the hint. Now there is no point. So any answer you have in your mind? Is it called?
Angiofibroma.
Trichoepithelium.
No, trichoepithelium.
It's not angiofibroma, though
Tricho-
blood vessels are seen. Yes, it's a cribriform appearance for trichoepithelium. It's okay. It's okay. Don't worry. Don't fight among yourselves. So now we go to the next team. Medical college, are you ready?
Yes, sir.
Okay. So here is your direct question. We can't describe any of these slides. We'll not do it for any team. So your time starts now. What condition is this? You have to say the appearance and the condition also. There is a very distinct appearance hinted in this picture.
Sir, can we have the hint?
Of course,
Yes.
you will have 5 points deducted, but you can always have the hint. It's a photodermatosis.
Sir, Porphyria cutaneous tarda, sir, festooning of dermal papilla.
Very good. Very good. Congratulations. So the festooning of the dermal papilla, as you can see, this is the bulla is the same. And here the dermal papilla has ingrown. So it's the festooning of the dermal papilla. And there is no point, but can you say what other classical finding we see in PCT?
Sir, what I think the caterpillar cells.
Yes, very good. Very good. So they get 5 points. Good. So now Team C, Arjikar, are you ready? Arjikar Medical College? Okay. So this is your direct question. Identify the condition and what is this? Where can you find this kind of histopathologic picture? Your time starts now. In which condition can you find a histopathologic picture like this? You can always ask for a hint, but you have to ask it in the right time.
Hint, please.
Okay. Just pick-
This is a Swiss cheese appearance due to paraffin injection, paraffinoma.
Okay. Are you sure it's paraffin or something else? So the thing is that this is a Swiss cheese appearance, but this is for silicon granuloma. Who injects paraffin in the breast? And why would one inject paraffin in the breast? So what to do? I think the observer needs to come in. So
They have said Swiss cheese.
yes, you have at least said Swiss cheese appearance. Arijit Kundu sir, are you there?
Yes,
Or is
I am
it-
here. Yes, I am here.
What can we do? Shall we give them 5 points because they have correctly identified the
You have 5 points.
appearance?
5 points.
Okay, okay. So as our observer sir has said, you'll get 5 points. So Arjikar gets 5 points. Congratulations. But there's a silicon granuloma. Okay, paraffin doesn't have much to do. So now the last team, tropical medicine. Are you ready? School of Tropical Medicine. Okay, so here's your direct question. A very classical histopathological picture. Identify the condition. Where you will get this kind of a picture. So your time starts now.
Sir, give us the hint.
Okay. Clinically, this is a psoriasiform lesion. The clinical appearance is of a psoriasiform lesion. But if you do a biopsy, it's not psoriasis, nowhere near to psoriasis. But there's a very classical picture. But clinically, you'll get a psoriasiform lesion. So now can you say the question? I mean, say the condition. Last 10 seconds remaining. You can take a guess. There is no negative marking. Okay, so your time is up. Any of the other teams want to take a try on this? No points
Yes.
involved. But-
Bowen's disease.
Bowen's disease, windblown appearance.
Windblown appearance.
Okay, very good. So this is indeed Bowen's disease. And as you know that clinically you will get a psoriasiform appearance, a scaly lesion. And this is a classical picture, windblown appearance. So no points was shared for this question. And so we now come to the end of the round 3. And now we'll say the scores for all of you. This is the midway of the quiz. We have 3 more rounds to go. So as we can see that School of Tropical Medicine is yet to start their proceedings, and both IPGMER and Medical College Kolkata are tied at 15 points each, and Arjikar Medical College is leading at this point with 20 points. So congratulations. Now we'll just have a change of guard because now Dr. Shreya will conduct the remaining part of the quiz.
Hello guys. So you have been doing very good. We still have 3 rounds to go and you can make up. Okay. So we'll go to our next round. We already have the scores. Dada has already announced. So the next round is STI and Hansen. There will be 2 questions pertaining to STI and there will be 2 questions from Hansen in no particular order. This time we'll be starting from team D. The next question will be for team C, B and A. Is that clear?
Yes, madam.
Yes, yes.
Okay, ma'am.
So team D, STM, are you ready for your question?
Yes, ma'am.
Okay, so we'll go to the first question for round 4, STI and Hansen. So this is a very classic picture and you have to identify the condition and the causative organism. Correctly identifying the both will fetch you 10 marks. Your time starts now.
Strawberry cervix, Trichomonas vaginalis.
Very good. You get 10 points. So this is a very this is a STI which is caused by Trichomonas vaginalis. This is a motile protozoan parasite, and it causes strawberry cervix. So very good. You have guessed it very correctly. You get 10 points. We'll go to team C now. Team C is Arjikor. Are you ready?
Yes, ma'am.
So this is your question. Which strain was used for the world's first leprosy vaccine? They have recently begun their trials, and your time starts now. World's first leprosy vaccine, which recently began trials, was derived from which strain?
Mycobacterium indicus prani.
That is correct. Yes. Mycobacterium indicus prani, earlier known as Mycobacterium veggie, was the strain that has been used for world's first leprosy vaccine, and they have recently begun their trials. Sorry, we have a technical glitch. Just 1 second. Wait. So you get 10 points. The next question is for Team B, Medical College. You ready?
Yes, ma'am.
Okay. So this is your question. We have a picture here, and you have to name the basophilic inclusion bodies which are composed of degenerated nuclear material located in the cytoplasm of endothelial cells, and they are particularly seen in LGB, right? So you have to name those bodies. Your time starts now. Think hard, you must have read it. In seconds to go.
Ma'am, Henderson-Patterson bodies.
No, that is incorrect. CHP bodies are found in Molluscum contagiosum. The correct answer is Gamma Fabry bodies. So these, as I have already mentioned, are basophilic inclusion bodies seen in LGB. And can anybody say what sign is being depicted in picture here? It's a very classic sign seen
Group
in
sign.
LGB.
Group sign.
The group sign. So team D does not get any point. We move to team A, IPGMER, for the next question. Are you ready?
Yes, madam.
Yes.
Okay. So this is the question. You have to identify the maneuver that is being done in this picture. Your time starts now. So basically, it's a bit tough. There is dorsal pressure being applied over the proximal phalanx to passively flex the MP joint, right?
Medical dorsal fixation.
Take any guess. You won't get negative marks. Okay, your time is up. Anybody else wants to take a guess? I agree this is a bit tough. No? Okay, so this is Weaver's maneuver. It is used for assessing claw hand deformity of the digits prior to reconstructive surgeries in leprosy patients. Something new you learned? Okay. So you basically apply dorsal pressure over the proximal phalanx to passively flex the joint, and that results in straightening of the distal joints and temporary correction of the claw deformity. All right, so we are at the end of round 4. We'll move to round 5 and then we'll come back to scores. Right? So we will now move to round 5, which is dermatotherapeutics. So these are basically very recent advances in dermatotherapeutics. And if you're well read, it will be very easy for you to answer. The order of questions will be again from team D to team A, right? So we start with team D. Are you ready? School of Tropical Medicine.
Yes, ma'am. Yes, ma'am.
So your question is, this is a topical synthetic inhibitor of tubulin polymerization that is being seen as a promising field treatment for actinic keratosis. In fact, it was very recently FDA approved in 2020. So you have to identify the drug, December 2020. Your time starts now. Ten seconds to go. This has been very recently approved. Okay, time is up. Any guesses from any other team? Any of you know the answer?
Ingenol mebutate.
No. Actually, in fact, Ingenol mebutate has been recently withdrawn from the market because of increased risk of SCC, right? That was in your prelims question also, I guess. So this is a new drug, which is terbinafine, which has been recently approved in December 2020. And it is used for field treatment for actinic keratosis that occur on the face and the scalp region. Okay, so we'll move to the next question. Team D does not get any marks for this. Next question is for Team C. Are you ready, Arjukar?
Yes, ma'am.
Okay. So this is your question. This is an IgG1 antibody targeting both interleukin 17A and 17F pathways and is currently under investigation as an effective treatment of psoriasis. So you have to identify this drug. Your time starts now. You can take a guess. No negative marks.
Rivolizumab.
No. The answer, in fact, is bimekizumab. This is a drug which is...
Rivolizumab.
No, that is incorrect. The answer is bimekizumab. Okay. So this basically is under investigation. A lot of trials are being done. The advantage with this is that it will block both the pathways 17A and 17F in contrast to secukinumab, which blocks only the 17A pathways, both the receptors, sorry. So Team C does not get any marks. We will move to Team B now, which is Medical College. You ready?
Yes, ma'am.
Okay. So your question is, a monoclonal antibody that targets TSLP, thymic stromal lymphopoietin, a cytokine implicated in the pathogenesis of atopic dermatitis. Your time starts now. So you have to identify that biologic, that antibody. That biologic. Take a guess. Actually, right. Okay.
Dupilumab is 413 antibody.
Time is up actually. So anybody else knows, has been reading about this?
Anti-TSLP antibody.
And yeah, the name of that antibody you have to tell. There's a specific name of that drug, which is tezepelumab. Okay, this is an anti-TSLP protein. So basically what happens is anti-TSLP protein, interleukin 25 and interleukin 33 are called as alarmins together. So they're the first molecules that are being released upon insult in a patient of atopic dermatitis, along with other of course in other Th2 diseases as well. So this kind of activates the innate lymphoid cells and the Th2 pathway is propagated. And this drug is also a future investigational drug for chronic spontaneous urticaria. Just a bit of a knowledge there. So okay, no problem. We'll go to our next question, which is for team A. IPGMER, you ready?
Yes.
Okay, so your question is, this agent recently got FDA approval to extend their age range for children 6 years and older for the treatment of onychomycosis. Your time starts now. Yeah. Initially, it was there for 12 years and above, but now it's been approved for children 6 years and older as well. Take a guess.
Tabivorol.
No, actually, this is efinaconazole solution 10%. I did not ask the other teams, but okay. And laliconazole 10%, terbinafine 10% lotions. They've all been approved recently for onychomycosis. They're the relatively newer drugs, and this one particularly was there in the market, but now the age range has been expanded. So no worries. This round went null and void for all the teams, but okay, it was a learning experience, learning session. These are all the recent advances, and you have to read a bit on these questions also. So we'll move to the last and final round. Should we tell the scores? Okay. So just a second, I'll be tabulated. Team 4, which is STM, they are at 10 points. Team 1 and 2, A and B, IPGMER and Medical College are at 15 points each. And Team 3, which is RGCOR, is at 30 points. So we move to the last round for today's session, which is dermatosurgery and cosmetic dermatology. We'll again start with Team D. Team D, STM, are you ready?
Yes, ma'am.
Okay, so your first question is, what is the only laser treatment that has been approved by FDA for melasma? The time starts now.
Fractional ablative laser. Fractional laser.
The wavelength, can you specify?
1500, 1550 or I'm not sure.
Yes, you're
1550.
correct. You're correct. We'll give it to you. This is fractional 1550 nanometer non-ablative laser. So you get 10 points. Very good. Lasers, they come as the last line therapy for melasma for recalcitrant cases not responding to triple combinations or hydroquinone containing preparations and other depigmenting agents, of course. So team D gets 10 points. Very good. We'll move to the next question for team C. Arjigar, are you ready?
Yes, ma'am.
Okay. So this is your question. Which dermatosurgical procedure was done in this patient? You have to name the procedure. Your time starts now. Take a guess. It's easy actually.
Punch grafting.
Yes. They have identified it correctly. This is sponge grafting. What is being shown? Can you tell us? What does the picture depict?
It is the donor side.
No, it is the recipient side. It shows cobblestoning. Okay. So this is a side effect of punch grafting, which is the cobblestoning appearance. So you have to use smaller sized and mesh grafting should be done, to combat this kind of side effect. Okay, very good. You get 10 points. Well done. We move to the second last question for today's session for Team B. Are you ready, Team B, Medical College?
Yes, ma'am.
Yes, ma'am.
Okay. So your question is, which drug was approved by FDA in 2020 for moderate to severe glabellar facial lines in adults? You have to name that particular drug that was approved by FDA. Take a guess, facial lines.
Botulinum toxin A.
But which you have to be specific. Of course, it is Botox, but that is pra-botulinum toxin A. They said botulinum toxin A. We cannot give that. No? Because this, we'll ask the observer, Arijit Kundu sir.
No, I don't think we can give them.
Okay, okay, sir. We'll not give it. Okay, sir. Great. So we'll move to the last question for Team A, IPGMER. Are you ready?
Yes, madam.
Yes, ma'am.
Okay, so the last and final question here goes for today's quiz. Which surgery uses the instruments that are shown in figure?
Bariatric surgery.
Your time starts now. They're saying bariatric surgery.
No.
Define it a bit. We need a little bit more specific answer. You're closer. That's all I can say.
Fat suction. Liposuction.
Final answer.
Liposuction.
Okay, that is correct. You get it correctly, 10 points. So there's a suction apparatus. We have infiltration cannula of different sizes. We have the suction cannula and pressure cuffs. So correctly said by Team A, liposuction, you get 10 points. So final scores will be announced by
Okay, so I think you guys had a good experience for the quiz, and I hope you guys enjoyed it. So we tried to put in
Yes.
some which are not too difficult, but there should be some, as we both believe that there should be something new for you to get on the learning process. And so we come to an end of this quiz. The results of this quiz will be announced during the valedictory function, which is just going to commence shortly. So have you all enjoyed the quiz?
Yes.
Yes.
Yes, sir. Yes, sir.
Okay, so that's great. So we come to an end. So thank you on behalf of both me and Shreya, and congratulations to all of you for doing a wonderful quiz program. So now I think we'll moving on to the valedictory function. So I will pass on to Dr. Adrija. So thank you very much. Thank you.